It's almost Labor Day, and schools and more workplaces are bringing people back together into the physical workplace. But with the threat of COVID-19 still looming, going back into work cannot mean business as usual. Good morning, I'm Kim Marshall, a Workers' Health and Safety Centre training representative supporting workplaces in southwestern Ontario. As Ontario's designated health and safety organization, Workers' Health and Safety Centre delivers a wide range of classrooms and now virtual classroom training courses to assist in protecting workers' health and safety. We've been producing weekly webinar series to help get information to you about how to fight this pandemic in your workplace. And we also have a 3-hour virtual classroom course, The Hazards of COVID-19, which you might want to register for. It's only $10, and you can register on our website, WHSC.on.ca. In previous webinars, we've talked about the characteristics of this virus, how it uses us to replicate and spread. We reviewed how workplaces can use distancing, hand hygiene, ventilation, and masks. Today, we want to show you a useful inspection tool that members of the Joint Health and Safety Committee can use to improve workplace safety from the virus that causes COVID-19. Many are questioning, when will the second wave happen? How do we know if asymptomatic people are in the workplace? Will my kids be safe going back to school? How will we ensure we do not bring this virus home to our elderly parents or younger children? How will my workplace enforce controls like safe distance, PPE, and adequate ventilation? These are challenging questions. One important way we get answers is through workplace inspections. In almost all workplaces, it's a legal requirement that worker member of the Joint Health and Safety Committee or Health and Safety representative must do inspections monthly. Joint Health and Safety Committees are required in workplaces of 20 or more workers, and a Health and Safety representative are required in workplaces of 5 to 19 workers. The format layout is simple. The worker Joint Health and Safety Committee member or Health and Safety representative doing the inspection goes through the list of questions in the middle column and checks off yes, no, or not applicable. In the last column, they describe any follow-up action required when necessary. It is divided into 9 sections: pre-inspection, physical distancing, workplace personal hygiene, cleaning and disinfecting, ventilation, personal protective equipment, mental health, illness containment and reporting, training, and information. The first section is pre-inspection. We can't list every question on the checklist during this webinar, but some to highlight ask, has a policy and program around COVID been implemented and introduced sufficiently? Was the Joint Health and Safety Committee meaningfully consulted, for example, on the decision which type of PPE will be used? Is the employer looking at the full range of controls at the source, along the path, and at the worker? Has the employer pursued the most effective controls, which are those at the source? For example, could the work be done from home? Here's a snapshot of how in-depth some of the questions are on the checklist. We now know that physical distancing is a key measure to prevent the various methods of COVID-19 transmission, including potential airborne transmission. As schools and other workplaces reopen, physical distancing often requires reorganizing the workplace to achieve the recommended 2-meter distance. Joint Health and Safety Committee members and Health and Safety representatives can ask questions like these from the inspection list. Is the workplace configured to allow a minimum of 2 meters between workers and others who might be in the workplace? To the degree possible, are workers assigned their own and not shared workstations and equipment? Are start times staggered to allow for physical distancing on transit and when arriving at the workplace? Do hallways and stairways have traffic flow that maintains 2 meters? Have occupancy limits been set and clearly communicated? Workplaces need to ensure workers can maintain proper hygiene practices. Our checklist for joint health and safety committees and health and safety representatives ask, are adequate hand washing facilities with soap, hot water, disposable towels, and touch-free or open bins available? Have hand dryers which spread germs been disabled? Have workers been provided with alcohol-based hand sanitizer where access to hand washing facility is not convenient or adequate? Are hand sanitizing stations available at all points of entry? The virus is forcing us quickly to change our behavior around hygiene. Now, whenever we walk into a building, we're being socialized to look for hand sanitizing stations immediately to prevent potential transmission. These practices are crucial in all settings, but especially in facilities such as gyms, schools, hospitals, and public transportation, where many people come together. The flow of the people is harder to control. Just over a week ago, for example, a fitness club in Brampton had to shut down after a worker tested positive for COVID-19, barely 2 weeks after they resumed operations under the Stage 3 reopening plan. When it comes to surfaces, just sanitizing will not do the trick. Both cleaning and sanitizing are needed to adequately clean the surface. Cleaning removes the dirt and impurities from the surface, but does not kill germs such as the coronavirus. And disinfecting alone kills germs on surfaces, but does not necessarily clean them. The two go hand in hand. We developed a webinar on effective cleaning and sanitizing that you can check out on our Facebook page or our YouTube channel. It goes into detail on good practices, safeguards for workers doing cleaning, and choosing the proper disinfectants and cleaning supplies. The questions in the COVID inspection checklist promote these practices by encouraging Joint Health and Safety Committee members and health and safety representatives to ask questions like, are high-touch surfaces, counters, handrails, doorknobs, cleaned and disinfected at least daily? The picture in the slide shows examples of high-touch surfaces like handrails, doors, light, and light switches. Is the general workplace clean and disinfected at least daily? Have cleaning protocols considered how to properly clean soft surfaces like rugs and chairs? If workstations and equipment is shared, are they cleaned and disinfected between people? Are cleaning and disinfecting products like single-use wipes available to workers so they can take additional measures? Are WHSC safety data sheets about cleaners and disinfectants available to the workers? Public Health Ontario published a fact sheet for cleaning and disinfecting for public settings such as schools, transit, college, and universities. It recommends that in addition to routine cleaning, surfaces with frequent high-touch surfaces are cleaned twice daily. We created the question that specifically lists high-touch surfaces to make sure all areas are considered. Proper ventilation is a key control along the path between the virus and the workers. Early in the pandemic, many industrial hygienists and other occupational specialists were already saying that, anecdotally, such as the high transmission on the cruise ships. The virus could be transmitted through the air with droplet spread. Since then, more than 230 scientists publicly called on health authorities, such as the World Health Organization, to recognize the potential for airborne spread of coronavirus, which the WHO has since accepted. The American Society of Heating, Refrigerating, and Air Conditioning Engineers, called ASHRAE, is a globally recognized standard-setting organization. ASHRAE has produced leading resources around ventilation to help reduce the potential for indoor airborne transmission. For more information, you can check out our resource called Enhanced Ventilation, Prudent Actions to Help Control Airborne Virus Transmission. ASHRAE resources have formed our COVID checklist, which asks questions like, has the HVAC system been assessed by a certified technician? Has the ventilation rate been increased or is running longer to enhance air exchange? Are exhaust fans in bathrooms, change rooms, and break rooms operating at full capacity? Is the relative humidity level being kept between 40 and 60%? In addition to other questions, the checklist also asks specific questions for healthcare facilities and references and ASHRAE guidance documents for those particular facilities. Workplace ventilation has a particular concern in schools, many of which are older and have developed a long repair backlog due to funding reductions. A Toronto Star article uses 3 graphics to show the worst, better, and best case scenario for proper ventilations in school. In the bad example, no fresh air is coming in from windows, the doors are closed, and the HVAC system is broken. The conditions would create stagnant air, which could increase the likelihood of viral transmissions if a student or teacher is infected with COVID-19. In a better example, the windows are open, the HVAC system has been fixed, and ideally has been adjusted to increase airflow and reduce air being recirculated. Filters should be changed frequently according to ASHRAE recommendations. Just like we try to practice, generally desks would be spread 2 meters apart. In the best case scenario, the picture at the bottom there, classes would be held outside, still maintaining the 2 meter distance between the students and between the teacher and the students. Next, we have a section on PPE, which asks questions such as, is the adequate supply of PPE? Please note the use of the word adequate and proper. Is the PPE readily available? Are all workplaces using, caring for, and discarding PPE properly? If required, are others such as visitors or customers using PPE? Joint Health and Safety Committee members and Health and Safety representatives should know the general rule from public health. When people can't maintain 2 meters distance, wear a mask if you're not required to already. This is even more important when people are indoors and building ventilation isn't adequate. The psychological of COVID cannot be underestimated. People are feeling isolated working from home, social gatherings are limited, the demands for work and home life are blurring and colliding. The checklist suggests Joint Health and Safety Committee members and Health and Safety representatives ask questions such as, is there evidence of workers experiencing anxiety and fear? Is a confidential mental health support plan available, for example, an employee assistance program, and are workers aware of it? The checklist mentions the value of surveying workers about potential sources and solutions. The Workers' Health and Safety Center just released a new module called Psychosocial Hazard Workplace Mental Health. Discuss how to identify psychosocial hazards, including how to conduct an effective survey. Ask a training representative in your area about the program for more details. The module was in high demand before the pandemic and has seen an even greater uptake in interest since. When workers are sick, they shouldn't be in the workplace. Every workplace must have a system for illness containment and reporting. Questions Joint Health and Safety Committee members and Health and Safety representatives can ask are, is there a protocol to restrict workers from work if they experience symptoms away from work, are exposed to a potential or confirmed case, or returning from international travel in the last 14 days? What about the same protocols for the public? Is there a process if workers are ill at work, exhibit COVID-like symptoms? What about if income in public too? Has the employer designated someone to report COVID-19 cases to the appropriate authorities? Is a system in place to track others who have entered the workplace, customers, clients, students, for example? Recently, a Toronto strip club worker and someone who visited the workplace tested positive for COVID-19. Toronto Public Health had to try and contact approximately 550 people who could have been infected by either one. They said the strip club is now following pandemic operating guidelines after an initial investigation found the venue was not following the rules. There's also the problem that workers will report to work sick because they don't have paid sick days. Talks continue between the federal and provincial governments to address similar situations where workers are impacted. Finally, we have a section on training and information. It includes a list of questions Joint Health and Safety Committee members and health and safety representatives can ask during their inspection to figure out whether workers and supervisors know important information about COVID. Questions they can ask include, can you describe routes of transmission and symptoms of COVID-19? Can you explain the various control measures established in the workplace? Example, 2-meter physical distancing, frequent and thorough hand washing. Do you know who you must report illnesses or concerns to? Are they wearing PPE properly? Try not to come off like you're testing anyone. A back and forth conversation is always most comfortable and informative. During the inspection, it's also important that the Joint Health and Safety Committee member or health and safety representative look for information posted on the Health and Safety Bulletin Board. Because of the evolving situation, it is important to make sure the most updated version of guidance documents are posted. As you can see, the checklist organizations that have information should be posted in the workplace. With more workplaces and schools bringing people into contact with each other, workplace health and safety committees and health and safety representatives have never been more important. Their monthly workplace inspection can make a real difference using types of questions in our checklist. We strongly encourage Joint Health and Safety Committee members and health and safety representatives to print and use it at your inspection. A link to the checklist will be emailed to you tomorrow morning. If you use the checklist and some questions are answered no, discuss it at your Joint Health and Safety Committee. It has never been more important than now. I hope this webinar has helped orient you to the Workers' Health and Safety Center inspection checklist and that you will use it and find it useful. This webinar is one in a series we've developed to help you keep your workplace safe throughout the pandemic. If you want to download this or any of our COVID-19 presentations, go to our website, WHSC.on.ca. A video of this and all our webinars will be posted on our YouTube channel, WHSC Training. The PowerPoint will be posted on our website as our inspection checklist. You'll get a follow-up email tomorrow morning giving you the exact links. In addition to the series of webinars to COVID-19, the Workers' Health and Safety Center is now offering virtual classroom training. We've modified a number of our most popular programs so they can be delivered via virtual classroom, including Joint Health and Safety Committee certification training and WHMIS. We also have a half-day course on the hazards of COVID-19 virus. You can register for our virtual classroom trainings on our website or by contacting me or any of our training service representatives around the province. Here's our contact information. You can also follow the latest developments via Facebook, Instagram, or Twitter. Let us know how we did today by completing the poll posted on your screen. Let's take some questions now. Should our worker member on the Joint Health and Safety Committee still perform the regular monthly inspection? Yes, absolutely. Sections 8 and 9 of the Occupational Health and Safety Act says that unless required by the regulations or by an inspector's order, a workers' health and safety rep or worker member of the Joint Health and Safety Committee must inspect the physical condition of the workplace at least once a month. It has never been more important. Remember that the Occupational Health and Safety Act says the inspection should be done by a certified member, if possible. If you're not in compliance with the certified member requirements, which is generally to have a worker and manager certified member on every committee, call us, send us an email. We have virtual classrooms running every week. the employer says a checklist is not necessary. Well, legally, it's not up to your employer. The Occupational Health and Safety Act says workplace inspections are to be done by workers in small workplaces by a worker health and safety representative, or in larger workplace by a worker member of the Joint Health and Safety Committee. Workers doing workplace inspection is a key part of the internal responsibility. So it is your inspection, and you can use the inspection checklist you want. Having said that, it is usually better that the workers do these inspections with supervisors with them. When everyone hears and sees the same thing, it helps communications. And supervisors often have the authority to make changes on the spot if you see something wrong. If you receive pushback about the checklist, discuss it at your Joint Health and Safety Committee meeting. It'd be hard to provide a compelling reason why this checklist should not be useful. My employer tries to limit our workplace inspection to a certain time frame. How will I be able to do both inspections? It is just one inspection. Just use the checklist as you go. But also, the Act does not limit the time for inspections. It just says a worker member of the Joint Health and Safety Committee must inspect the physical condition of the workplace at least once a month. The amount of time required will be different in different workplaces. The Act does say that if it is not practical to inspect the entire workplace every month, parts of the workplace should be done each month on an agreed schedule. But that would be some pretty sprawling places where it's not possible or feasible to inspect the whole place. We're trying to protect people from a pandemic. Best advice for the worker and the management representative: act in good faith, follow the legislation, and be reasonable. Inspections happen more frequently than once a month during COVID. There's definitely an argument to be made for more than one inspection per month, especially in public settings such as healthcare facilities. Some best practice we've heard are inspections twice a month and a dedicated pandemic subcommittee of the Joint Health and Safety Committee to address the concerns of COVID-19 specific problems. We hope you enjoyed today's webinar. Thank you for joining us. Bye for now.